Now, today is No Tobacco Day across the globe, and the country's health department plans to use World No Tobacco Day to promote a ban on smoking in some public and indoor areas. The World No Tobacco Day is commemorated annually on the 31st of May to highlight the health and other risks associated with tobacco use. Smoking is associated with lung diseases that include tuberculosis, heart and other cardiovascular diseases, which are associated with leading causes of death throughout the world. And the Department of Health says it will use the commemoration to focus on strengthening legislative measures to curb the demand for tobacco products. And the department is also encouraging stakeholders and members of the public to submit comments on the Control of Tobacco and Electronic Delivery Systems Bill. And joining us on the phone line is Acting Director for Health Promotion, and that's Lorato Mahura. Good morning to you, and thank you so much for your time. And just in terms of what activities will be taking place today, and especially as you're advocating for more stringent legislation on the demand or use of tobacco products.
Hi, Cindy. This is Lorato. Thank you for having me. You know, we at the National Department of Health, but most of the activities are taking place at provincial level. The different provinces have their own programs, and at the National Department, we sort of providing the nation with information through media. But because discussions around tobacco as a health issue require that people talk like on an interpersonal basis so that they understand the issues. So more focus would be on health dialogues, you know, taxi rank activations, workshops, formal training sessions, more like academic sessions. That is what is happening, and then the hype in the media.
And Lorato, I mean, we always say that prevention is better than cure, and particularly impressionable, gullible young people who may want to experiment with tobacco use. Is that where your main target audience is?
Yeah, considering the fact that we recently came out of the World Conference on Tobacco or Health that was held in Cape Town in March, where the young people came up with a declaration to strengthen measures that works towards a tobacco-free generation. They are saying that we should be having kids that are born in 2010 and after 2010. They should be actually tobacco-free generation. So what we would like to promote and advocate for in the Department of Health is that those that have not started smoking should not. We're closing the tap because once you start, because tobacco has an addictive substance, nicotine, we know that you're going to be continuing. So if we're saying there should be a cutoff in terms of the generation, in terms of initiating smoking, then it will help us to alleviate the problems that the tobacco use is putting on the public health sector.
What about punitive measures, though, especially with those that do not comply with the law and that will make tobacco products accessible to underage users?
Laws will differ depending on what we've put in the bill. For instance, let me just cite an example. What we're saying is that if you're smoking in a car and the child is in the car, you could be in prison for about 3 months, something of that sort. And in the past, there used never to be a punishment for such offenses. And the punitive measures that we're coming up with are actually trying to protect the non-smokers, because smokers are just doing it indiscriminately and everywhere. And then you find out that non-smokers are left unprotected. So we're trying to be sort of hard on the legislation around smokers not being sensitive to the non-smokers.
Yeah. Are you also calling for public vigilance? In other words, where you can report a case, as you made that example of children being in a car with adults smoking, etc., where you can report such behavior?
Already the public has taken upon themselves to report such cases. But then sometimes you find out that when they report cases, the law is silent in the issues that they are reporting. So those are the loops that we're trying to close.
And a message to parents as well, or maybe caregivers who may send children on an errand to buy a pack of cigarettes, and children emulating that behavior, thinking that it's cool or it's acceptable. What message are you sending?
Parents should start reading a lot about tobacco issues. Don't just get messages from the manufacturers or the people that are selling the product. Just know that they are harmful. We're trying to come up with laws that would actually prevent children from buying that over the vending machines. We're trying to come up with laws that will do away with vending machines. But we need help from you as well. And then there's a call for not doing away with street vendors. We need to do away with that because those are easily accessible. If you buy looses one by one, it means that the youth are going to afford buying cigarettes. So support us in the call to do away with those things.
Yes, but there are those that could argue that that's the only source of income they have. They may not have any other job prospects or even revenue streams. What then are they meant to do if selling a loose straw, for example, is the only other option?
We say you should remember tobacco control lies within the different government departments or within the different sectors. That would be the trade sector. If we're introducing something new, it should mean we should also look at viable alternatives. There are other range of products that they could focus on, that they could sell, as opposed to looking at products that are killing people. You still remember people used to sell like hydroquinone creams, and it was sort of an income generation type of activity. But people are no longer selling that, but they just diversified into something new. That is possible for them to diversify into something new, other than holding on to what is doing harm to the nation, holding on to what is killing the people.
And the liability, I suppose, and corporate social responsibility on the part of tobacco manufacturers, do you think that it is adequate in what they give back to society, considering, as you said, the health risk of tobacco use and the fact that it now puts pressure on the public healthcare system? Is there for you enough that, or is it commensurate in terms of what the tobacco manufacturers receive in revenue or profits based on the impact that the product has?
They are not giving enough. You should remember, for instance, let's just make one example. If a person has been smoking for too long and then this person gets cancer, it takes long. The disease will take long to progress. And what happens in the meantime? The very same person goes back to the health sector. You still have to offer chemotherapy, radiotherapy, and other forms of treatment and expensive treatment. And by the time, if it happens, that the person dies as well, how much strain would this person would have put on the health system? We don't think about that. People say it's my right, I need to smoke, but they forget that when sickness steps in, it now becomes the health sector's problem. It's no longer their problem.
I mean, how
that
then,
money could have been used somewhere else.
Correct, Lorato. And I mean, I'm just trying to balance things here in the sense that on the one side you have an industry that obviously is a multi-billion-dollar industry that is thriving because of the addiction or addictive nature of the product. And on the other side, it also employs a number of people, and yet the converse is that it also impacts the health or the quality of health of people as well.
But you need healthy people to keep your economy going. So if now you reduce their productivity, you take away their health, good health, it still means that they are not even giving what they're supposed to be giving in terms of productivity. And then, if it's the Department of Health suggesting that let's go this route and then people might lose their income, people might lose their jobs, we're talking about what percentage of jobs are they offering to South Africans? It's a very minimal percentage. They're sort of bloating their stats. But we'll have to get back. Labour has to come in and tell us how much percentage of jobs in South Africa are offered by the tobacco industry. Those are the questions that need to be answered. And the other thing that we also need to look at, even tobacco industry, like for instance, they come up with business decisions whereby people's jobs are implicated. So when it's them doing it, it's okay for their own profit margins. But when it's the department suggesting it for the protection of public health, it's not okay. It can't be right.
So, Lorato, in your view, just the objectives for the day, so it doesn't just become another a calendar event that we mark on, 31st of May and then swiftly move on. What would you like to see that is tangible and that is also doable?
would like us as the civil society, as government, as other sectors supporting the young people. That's where we should be starting. If they themselves are saying we are keen to come in and be the activists in tobacco control, let's give them a chance to do that. Because we know ultimately, some years down the line, we'll be able to close the tap of people getting addicted to nicotine that kills people and other ingredients that are harmful to our body.
But I mean, it has become sort of an unpalatable exercise, if you will. If you remember with, I think it was then Dr. Dlamini Zuma as health minister who had introduced the prevention of smoking in public areas, but you still find there are restaurants or other merchants that allow for smoking. So how are you going to eradicate that if in society, again, people have the rights, etc., and they're given the platform to do so?
It's very funny because they themselves, the restaurants, are actually beginning to go for 100% smoke-free areas. The law is actually allowing them to be having space for 25% free, for 25% smoking. They themselves are moving to 100%, a total ban on smoking. And there was a study that was done by UCT where they have confirmed that 44% are already going that route. And then you also find the 44% that have decided that people will smoke outside as opposed to smoking inside. But then there are many issues that we should be looking at. The people that are employed in those restaurants should also be protected. It's not like if we allocate 25% smoking, it's good. We are realizing that in terms of labor, it's not good for the workers as well. And then we are realizing that even if you allocate 25% smoking area, the air particles will still move to the other 75% where it's supposed to be non-smoking. And then you get what we call secondary smoking. And those are the things that we're trying to eliminate. And in the households, studies are showing that about 25% of youth already are exposed. Those that are not smoking are exposed to smoke. And the industry will also claim that when we introduce the 100% ban, then they are going to lose their revenues. There is no such. Studies are already showing that revenues are not changing at all because it's the customers themselves that are requesting restaurant owners to move that way. For instance, Wimpy is doing it. Nobody's realizing that Wimpy is doing it.
Yeah, we're going to have to leave it there in the interest of time, but thank you so much for joining us. That is Lorato Mahura. She is the Acting Director for Health Promotion, talking about World No Tobacco Day that we're observing on the 31st of May. You can share your thoughts on social media. It's at Afro Worldview.